Interpretation of blood pressure readings. According to the recent AHA guidelines, a systolic blood pressure less than 120 mm of mercury and a diastolic blood pressure less than 80 mm of mercury is considered normal. Pulse pressure is the difference between systolic and diastolic blood pressure and is normal at 40 and 60 mm of mercury. Normal mean arterial pressure is 100 mm of mercury. To confirm the presence of hypertension, multiple BP recordings should be taken, with a sphygmomanometer, on several occasions. Classification of hypertension is shown in the presentation. Common causes of hypertension include essential or primary hypertension, which is more common. Secondary hypertension is caused due to renal, endocrine disorders, pheochromocytoma, diabetes, obstructive sleep apnea, and consumption of oral contraceptives, to name a few. Isolated systolic hypertension is when systolic blood pressure is more than 140 mm of mercury, and diastolic blood pressure is less than 90 mm of mercury. Seen in old age above 65 years. In hypertensive urgency, BP is markedly elevated, without evidence of end organ damage. Control of the elevated BP can be done gradually. In hypertensive emergencies, the BP is markedly elevated, with evidence of end organ damage. The control of the elevated BP has to be done immediately to prevent further damage. This includes conditions such as malignant hypertension is a triad of blood pressure of greater than 200 over 140 mm of mercury, grade 4 retinopathy, and renal dysfunction. Accelerated hypertension is a significant recent increase in blood pressure over previous hypertensive levels, associated with evidence of vascular damage on fundoscopic examination, but without papilledema. White coat hypertension is a transient increase in blood pressure in normal individuals when BP is recorded in a physician's consulting room or in a hospital. Pseudohypertension is a false increase in blood pressure recording due to stiff and non-compliant vessels or Osler's sign, seen in old age. Actual intra-arterial BP is lower than the BP, measured by a sphygmomanometer. Transient hypertension is seen for a transient phase of time, when the patient is under stress, or when he is having an underlying disorder. Seen in acute cerebrovascular accidents, acute myocardial infarction, acute glomerulonephritis, pregnancy, and acute intermittent porphyria. Paroxysmal hypertension. This is seen in pheochromocytoma. However, a patient with pheochromocytoma may be normotensive, hypotensive, or hypertensive. Labile hypertension. Patients sometimes, but not always, have arterial pressure within the hypertensive range. Paradoxical hypertension is when patients show an increase in BP even when on antihypertensive drugs. A few examples are patients with diabetes mellitus and hypertension, on beta blockers, high doses of clonidine, bilateral renal artery stenosis, and administration of beta blockers in pheochromocytoma. Hypertensive states is a marked increase in both systolic and diastolic BP, seen in normal individuals during sexual intercourse or on diving. May be useful in detecting pulsus paradoxus and pulsus alternans. Hypotension. Postural hypotension. Hypotension is defined as blood pressure readings of systolic pressure lower than 90 mm of mercury or diastolic pressure lower than 60 mm of mercury. When there is a fall in systolic pressure of greater than 20 mm of mercury or a fall in diastolic pressure of greater than 10 mm of mercury after standing for 3 minutes from the lying posture, the patient is said to have postural hypotension. Causes include hypovolemia, autonomic neuropathy, ganglion blocking agents, centrally acting antihypertensives, myocardial pump failure, and pheochromocytoma. Differences in systolic pressure, by 10 millimeters of mercury, between the two arms, when measured simultaneously, or in rapid sequence, suggest obstructive lesions of aorta, innominate, or subclavian arteries. Systolic pressure in the legs is up to 20 millimeters of mercury higher than in the arms. Diastolic BP is the same. If systolic pressure in the popliteal artery exceeds brachial artery by greater than 20 millimeters of mercury, called the Hill's sign, aortic regurgitation is suspected. Lower limb BP is useful in detecting coarctation and obstructive disease of aorta. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.